Now for the next technique we are discussing, which is used in stopping abnormal bleeding from the uterus, is what is known as a uterine tamponade. Uterine tamponade. Okay, so you can see uterine tamponade. You put a balloon in the uterus so that it will make it big again. Do you understand? Or it can be your fist. It can be balloon or your fist, anyone. Okay, so of course it's used in managing bleeding. So anything that will make abnormal bleeding from the uterus, you use this. So it's a life-saving technique. It's used to control acute uterine bleeding. Okay, especially after the woman gave birth, she's bleeding abnormally, you use this. Or just like that, there's some abnormal uterine bleedings. So it involves applying pressure inside the uterus just to stop the bleeding. Okay, so what's a uterine tamponade? It's a mechanical method to control bleeding by inserting a device and inflating it. Could be a balloon, literally, or your fist. You can make a fist like this. Well, after you put your hand, then you make the fist inside. Do you understand? It can serve as this pressure helps to compress the blood vessels. Do you understand? It now promotes them to clot, to stop bleeding. Alright, so common devices used, we have the Bakri Balloon, we have the Sengstaken Blakemore Tube, have the Foley catheter, or have the condom catheter. Also your hand. Note that, okay, if you're in a resource limiting place, can you see this? Put your hand. So it's used in controlling bleeding after birth, acute abnormal uterine bleeding. Okay, then temporal stabilization before surgical intervention. So sometimes the bleeding is so much, you know that you do surgery, but you can use this one to just stabilize the patient first before you go into the surgery. So, but standard, you use the balloons. Okay, that's what is called the Bakri Balloon. So insert the device into the uterine cavity. It's after you insert that you inflate with normal saline, not air. Okay, monitor closely for signs of continual bleeding or infection. Then remove after the person is stabilized and the bleeding is basically stopped.